Today on the Frontline Health Podcast. People distrust institutions more now than they did before the COVID-19 pandemic. And so that kind of puts the prerogative on people who are in positions of expertise to kind of have a little bit more humility and be willing to talk based on arguments and not on credentials. And also for people who might not be an expert to do their own research and to investigate things for themselves, to ask questions. And so there can just be a larger dose of humility all around to where people can actually have conversations based on substance rather than just on position or credentials or who can shout the loudest. Hello and welcome back to another episode of the Frontline Health Podcast by Centurion, where we share health news, tips, and insights to help you take ownership of your health and your life. My name is Evan Patrick. With me is Troy Duell, our founder and CEO here at Centurion Health. We've got another episode of health headline highlights to share with you from the month of June.
Yeah, and our first one, we'll go ahead and jump right into it. It says MMR vaccination rates dropped during COVID-19 pandemic study. So apparently the MMR vaccination rates declined in most U.S. counties during and after the COVID-19 pandemic. And while the headlines sound like it dropped 10%, really it was just a 2.5% drop. So it went from 93.9% to 91.2% of people getting vaccinated on the county level. So we are seeing a drop, but why do you think, in your mind, there is a drop? And why would COVID-19 have anything to do with that?
Yeah, well, we were having a really good conversation before we actually turned on the microphone earlier, and we said maybe we should turn on the microphone for this.
Yes.
But an observation that I had just from the COVID-19 pandemic was back in 2020, the conversation was, is the COVID-19 vaccine safe? Is it going to be effective? Is it really the answer that the experts are saying it is? And is there really any way to know if it's going to be that way when they're saying it with such great confidence and certainty? And I think the more confidence and certainty the experts had behind it, when most people were able to go, hey, I don't think, even if it is effective or even if it does work, I don't think they have the information to be able to make that kind of a recommendation to everyone. And so the conversation has devolved from, is the COVID-19 vaccine safe and effective, to can we trust any vaccines at all? So you have parents who are making the decision to, when they would have otherwise trusted vaccines, they're making the decision to just withhold maybe all vaccines. And so it's polarized us even further rather than sort of being able to discuss on an individual basis, is this vaccine safe? Is this vaccine necessary? You had some really good insights on that.
Yeah, and I think to your point, we saw a true new level of distrust in our medical community because we were pushed something that we saw, and I think almost everybody knows someone who had some type of issue with the vaccine. And because of that, I think it really started to make everybody a little bit more aware of vaccines and kind of how they're regulated, and the fact that vaccines don't have to worry about lawsuits because they have liability protection from the government. I think that was a big red flag for most of the public when that became news and more people became aware of that. I mean, it's been like that since the 80s, but the fact that most people didn't know it until something like this happened, I think certainly was a big issue that came along. And then you have different individual vaccines that we talked about, like the hepatitis vaccine for a newborn. The only reason you take a hepatitis vaccine is if you're a drug user. So most newborns aren't doing a lot of crack pipe smoking. They're not doing anything along those lines.
You would hope.
Yeah. So why do we even need to push that and really cause their immune system to become stressed out? Because that's ultimately what we're doing, is we're stressing out their immune system. Now, if their mom was a drug user, then that may not be a bad idea to go ahead and give that child the hepatitis vaccine, because that could be passed on to them. But we need to really take a look at each individual vaccine and begin to go, does this make sense? Do we have treatments for this disease now that we didn't in the past, therefore we needed it? And what's the severity of this disease? Because ultimately, when you start to add up all these immune system damage level incidences with all these vaccines that you're just pushing on a body, I really think it creates a huge toll over time on the body, especially when you're talking about a kid who's under 5 with all the vaccines that you're giving them. So a total reassessment of it, but I don't think we need to throw out the baby with the bathwater, because there are some vaccines that I think are still very important and still bring value. But I do believe that we need to look at each individual vaccine and say, is this worth it? Do we have treatment for it? And what do we need to kind of continue to take? And what is a good idea to not cause my kid, my grandkids, whatever, to really put that pressure on their immune system that most people don't need that added pressure.
Yeah, the crazy thing is what you mentioned is, across institutions, people, or across different realms and categories, people distrust institutions more now than they did before the COVID-19 pandemic. And so that kind of puts the prerogative on people who are in positions of expertise to kind of have a little bit more humility and be willing to talk based on arguments and not on credentials. And also for people who might not be an expert to do their own research and to investigate things for themselves, to ask questions. And so there can just be a larger dose of humility all around, to where people can actually have conversations based on substance rather than just on position or credentials or who can shout the loudest.
Totally agree, but it's going to take an act of Congress maybe for us to get there, but hopeful that we'll start to see some tables turn and we'll get moving in the right direction with that.
Absolutely. Our second health headline, moving along, pregnant women should talk to their doctors about COVID-19 vaccines. The FDA now advises pregnant women to consult their doctors individually regarding COVID-19 vaccination, as the CDC has dropped blanket recommendations. Troy, before we even go any further in this conversation, as someone who works for a pharmaceutical and supplement company, isn't it usually advisable to caution pregnant women on pretty much any product that's out there to consult with their healthcare provider before starting something new?
It is, and I think especially when you've got a product that, they made that in 9 months, and most of these products that come out have years, and there's years of data to say, hey, this isn't good for pregnant women, or this is okay for pregnant women to have. And we didn't have that with the COVID-19 vaccine. So I think we talked about a new element of distrust amongst the medical community. I think that's one area that certainly happened, because I was listening to testimony before the Congress a few weeks ago. I don't know if you caught it, but one of the doctors there, Dr. James Thorpe, he's a maternal fetal medicine, which is for high-risk pregnancies. He gave a staggering stat, which said that the COVID-19 vaccines had an 82% rate of miscarriage in the first trimester for those women who got the vaccine. And amazingly, he said it was equivalent to one of the abortion drugs. I believe he said the RU486 abortion drug. So that in and of itself is staggering to think. We were pushing that on pregnant women, saying that in order to keep their pregnancy safe and them safe, that they needed to have this vaccine. And yet one of the studies came out showing that 82% of women had this incredible miscarriage rate.
I mean, that's really chilling.
It is.
To hear
it's
you say
disturbing.
That. It is. The CDC no longer universally recommends COVID vaccines for pregnant women or healthy children, as we've been discussing. And the FDA is really starting to emphasize these individual decisions based on doctor-patient discussions, which that just seems like good medicine and good diligence on the part of the patient to just have a conversation with their doctor.
It does seem like maybe that's the way medicine was supposed to be.
Yeah.
That you always should talk with your physician. And again, if we learned nothing more out of COVID, it's, hey, take ownership of your health. Have that conversation with your doctor. Don't just listen to what he says, but ask questions and begin to be a true advocate for your own health, which we talk about all the time on this.
Exactly. And it doesn't have to be an adversarial relationship.
That's
It is
right.
this symbiotic relationship of, hey, this is a trusted advisor, and hey, I'm somebody who is trying to be diligent and make decisions for myself. And so there's cohesion there in working together. The trials, important to point out, the trials on pregnant women were limited, with Pfizer ending its trial early, wonder why, and Moderna's being terminated. Interesting things to consider with that health headline.
Absolutely. Our third health headline this month is the new COVID variant. I know it feels like we're going COVID crazy, but there were a lot of headlines this month on COVID, and this one is kind of shocking as well. The new COVID variant NB181 started spreading worldwide, in what we know. So apparently there's a new COVID-19 variant, the NB181. It started in Asia, China.
Seen this movie before.
Yeah, in China, and it's spreading across Southeast Asia. And the WHO says that there is no increased public health risk yet, which, of course, we've heard that story before as well, that there was no risk, you can still go about your daily activities, and then all of a sudden something else happens. But obviously, when you're talking about China and Southeast Asia, we're not real sure what the numbers are saying, because they're not giving us true, transparent data. So we're kind of taking some guesses on what's going on over there.
Yeah. I would have a hard time imagining that this would turn into something like what we saw back in 2020. I would have to think that things would not play out at all like they did before, based on a lot of this new information that we're finding out, especially the first two health headlines that we talked about today.
Yeah, I totally agree. And I think we also have history to tell us that most of those variants continued to get less and less drastic as they came out. So hopeful that this is the same.
Mm-hmm. Our last health headline that deals with COVID. New COVID variant has unique symptom, how to prevent and relieve it. So as we were just talking about, this NB181 COVID variant, it's causing a distinct sore throat symptom. Doctors recommend preventative and symptomatic remedies. Some other things we know: it may be more transmissible and immune evasive than previous strains. A razor blade sore throat is the way that it's being described, is a commonly reported symptom. Doesn't sound like it feels very good to me.
No, razor blades usually don't feel good on your throat, I wouldn't think.
No, definitely not. Not that I've ever tried it, but
Right.
it doesn't sound like it would feel good. Remedies include vitamin C, D, zinc, iodine sprays, NaC, and baking soda rinses.
Yeah, so really I think the interesting thing to me when you start reading about those remedies, it's not much different than any other COVID variant that we've had. We know that vitamin C, D, zinc, all those things are super important in our health, in our immune health. And then throwing in the NaC, I think we know that that's going to help your liver function the best way it can. So none of that is surprising. You know, I would throw in that quercetin, because we know that that seems to work well and has ever since the COVID-19 pandemic started. So,
You know, me personally, if I'm exposed to this variant, I'm going to get on some Defender Immunity Boost and have all of those things, the vitamin C, D, zinc, and quercetin all in one.
That's
and
right.
then if I get it, I'm going to take some Ninja Cough and get that analgesic effect for the sore throat.
That's brilliant.
That's just me personally.
And when you're just about to go to sleep, why not take some Defender PM?
While you're at it, I mean, you've got everything you need right there with those three products.
You really do. I
have to say.
I like the way you think. I really do. Well, our final health headline for this month: kids' breakfast cereals pack more fat, sodium, and sugar than a decade ago. I don't think any of us are too surprised by that, but it's the article talked about how cereals today are significantly less nutritious, with higher fat to the tune of about 33% more fat, higher sodium to the tune of about 32% more sodium, and higher sugar at about 10% than those cereals that we found in 2010. So pretty amazing that we're just continuing to see this escalation of processed foods and foods like cereals that really are contributing to a health crisis in the United States.
Mm-hmm. Do you know when this research was actually conducted to see these this nutrient information?
That would have been this year. So in 2025, I guess. Yeah.
Interesting. I have wondered if we would start to see a shift in some other things aside from just, the food dyes. We know that there's a timeline now on that with different things in our country with the new health secretary. But I was curious to know if, are we going to start to see that shift with just healthier foods all around as the consumers, opinions are kind of shaped by the events we see going on.
Yeah, I hope so. One of the other headlines that I saw that we didn't talk about or won't talk about was Mars Corporation, the ones that make Skittles. They are taking out some of the dyes. They are doing that ahead of schedule. So hopefully we're going to see some of that impact long term as we get some of these things out of our food. So, I think it's always important to understand the best breakfast or best nutrition we can get is always look for some protein-rich products like eggs, yogurt, or anything else like that for breakfast. So I think that's a good reminder for all of us that we need to be eating a little bit healthier, especially in the morning.
Absolutely. Yesterday morning was the first day that I skipped breakfast in probably, close to a year. And normally I do my eggs and my toast and usually a piece of fruit or something like that. And I felt miserable yesterday compared to what I know I'm supposed to feel like.
Yeah, it's so true because that food can really set the tone for your day. And, it's a big deal.
Absolutely. Right. Yep. So as we talk about these different things, especially when we look at news headlines, it's easy for, I think, people to hear this and maybe even as they're thinking about these things themselves, to look at other people such as, big pharma or these food corporations that are putting these things in the products that they're consuming or their children are consuming and go, those guys are the problem. But what we're really about on this show is encouraging people to take ownership of their own health. Which means we're not just going to point fingers at others. We're not going to point fingers at big pharma or the government or these big food corporations. We're actually going to take ownership of our health on our own and do what we can do to control these things and put it in our bodies and take care of our bodies the best way that we can.
Very true. And I don't think it could be said any better than that because ultimately nobody's putting a gun to our head to go eat these cereals or buy these cereals for our kids or to take these drugs without our input.
That's right.
So we've got to be in control of our health and in control of our actions, and we do that by really taking ownership one little bit at a time. And I think we can turn the tide of this health crisis that's in the U.S.
Let's do it. Is there anything else you want to say before we end the episode?
I don't think so. Thanks.
All right. Well, thank you for having this conversation and for sharing these health headlines, Troy. And thank you for tuning into this episode of the Frontline Health Podcast by Centurion. As always, go out and take ownership of your health because you are your best health advocate. If you enjoyed what you heard today on the podcast, please consider leaving us a review. We would love to hear your feedback and connect with you further. You can also follow us on Instagram, X, TikTok, and YouTube. And for safe, effective, and affordable health and wellness products made in the USA, visit www.centurion.health. Thanks for listening. We'll see you next time.